Some of you may be suffering from aches and pains that can readily be helped and affected by an intervention like dry needling. But you might be thinking to yourself, does dry needling hurt? Maybe you've had negative experiences in the past with a blood draw or a negative experience with an injection. Well, there are a couple of different differences between an injection needle and a acupuncture needle utilized for dry needling. As you can see here, this is one of the needles that we use for blood draws in the office when we're doing things like comprehensive wellness panels or blood draws for food sensitivity testing. And you can see I've actually fit 4 of our regular acupuncture needles inside of the injection portion of our blood draw needle. So I'm not going to lie to you. Dry needling can be somewhat painful at times. Whenever we're sticking a needle inside the body, this can be an uncomfortable experience. However, the action of the needle is quite different, and the structure of the needle is different as well. So instead of using a serrated needle that is designed to pierce and shred tissues apart, we're using tissues that are more bullet hole in shape and can actually just push tissues apart as it slides through the fascia and connective tissues into the target muscle or target zone that we're trying to apply this therapy to. And instead of injecting a substance into the body, what we're doing is we're just placing the needle in, and then we're either leaving it there or perhaps providing some acupuncture or dry needling stimulation to those neurological tissues. So, can dry needling be painful? Yes, it can be a somewhat unpleasant experience, and we can actually stimulate what's called a twitch response, which is a stimulation of the mechanoreceptors located within the muscle itself. However, this twitch response is oftentimes a good sign of us getting a good therapeutic intervention in the local muscle tissue. Once we stimulate those mechanoreceptors, such as the annulospiral endings of the muscle spindles or the Golgi tendon organs, oftentimes that muscle twitch works like a fuse going out of a light. So the lights will turn on very bright for a second, and then they will go off. In the same way, the muscle will twitch and contract, and then we will have the net effect of having a more relaxed muscle and muscle fiber after that muscle twitch response. Oftentimes people will experience some soreness for 24 to 48 hours, but we find this to typically be self-limiting, meaning that this muscle soreness will go away and it will actually help you get back to activities faster than dealing with the persistent pain that brought you in for that intervention in the first place. So all in all, dry needling can be a little bit uncomfortable during the treatment. However, the needles that we're using are much smaller than typical needles used for injections and blood draws. And typically, within 24 to 48 hours, we're going to have you feeling much, much better than before. You'll have improvements in your range of motion, as well as decreased pain in the muscles and connective tissues that we treat. So come in today and maybe ask us about dry needling and if that's an intervention that's correct for you.